Hyperlipidemia is a topic we are going to cover in this video. Hyperlipidemia, also known as dyslipidemia or high cholesterol, is a medical term for abnormally high levels of fats or lipids in the blood, which include cholesterol and triglycerides. Client can inherit it or develop it from lifestyle factors including diet and too little physical activity. The liver creates cholesterol to help client digest food and make things like hormones. But client also eat cholesterol in foods from the meat and dairy else. As the liver can make as much cholesterol as client need, the cholesterol in foods client eat is extra. Cholesterol is a fatty substance found in the blood that travels through the bloodstream on proteins called lipoproteins. The body needs cholesterol to build healthy cells, but when client has too much cholesterol in the blood, it can build up on the walls of the blood vessels and the client can develop fatty deposits in the blood vessels and form plaque. Eventually, plaque deposits grow larger and begin to clog up the arteries, making it difficult for enough blood to flow through the arteries. Sometimes these deposits can break suddenly and form a clot that causes a heart attack or stroke. This may also lead to heart diseases, peripheral artery disease, which can lead to limb ischemia or gangrene. Types of lipids. Cholesterol is carried through the blood attached to proteins. This combination of proteins and cholesterol is called a lipoprotein. There are different types of cholesterol based on what the lipoprotein carries. Total cholesterol and triglycerides are two of the major lipids in the body. They are transported through the bloodstream by lipoproteins. Low-density lipoprotein is also known as bad cholesterol. It builds up in the artery walls, making them hard and narrow. Another type is very low density lipoprotein or VLDL is also called bad because it carries triglycerides that add to the artery plaque. Too much of it can lead to heart disease. Next type is high density lipoprotein or good cholesterol. This type carries cholesterol through the blood to the liver where it is used to build cells and make hormones among other things. The liver gets rid of cholesterol that is not used. If clients don't have enough HDL, cholesterol builds up in the blood instead of being carried away by the liver. HDL cleans up excess bad cholesterol and moves it away from the arteries back to the liver. In this case, it is clearing the way for the blood to get through the blood vessels. For the HDL, clients don't want to have a number lower than 40 mg per dl. Triglycerides are another type of lipid. This is the most common type of fat in the body. They mostly come from foods clients eat that are high in fat. Hyperlipidemia is an imbalance of cholesterol in the blood caused by a combination of having too much LDL cholesterol and not enough HDL cholesterol to clear it up. Bad cholesterol, that is LDL, is the most dangerous type because it causes hardened cholesterol deposits, that is plaque, to collect inside of the blood vessels. This makes it harder for the blood to get through, which puts client at risk for a stroke or heart attack. The plaque itself can be irritated or inflamed, which can cause a clot to form around it. This can cause a stroke or heart attack depending on where the blockage is. The goal is to lower harmful cholesterol levels. Doing so, we can reduce the risk of heart disease, heart attack, stroke, and other problems. Hyperlipidemia is a group of metabolic abnormalities resulting in combinations of elevated serum cholesterol. The most common type of hyperlipidemia is high cholesterol. Other forms of hyperlipidemia include hypertriglyceridemia and mixed hyperlipidemia, in which both cholesterol and triglyceride levels are high. High cholesterol can be inherited, but it is often the result of unhealthy lifestyle choices, which make it preventable and treatable. A healthy diet, regular exercise, and sometimes medication can help reduce high cholesterol. Hyperlipidemia is usually quite manageable, though the emergency events should be avoided. The key is an early diagnosis and treatment plan to prevent its progression. What is the difference between hyperlipidemia and hypercholesterolemia? If client has hyperlipidemia, client has high lipid levels, including triglycerides and LDL in the blood. Hypercholesterolemia means only LDL levels are too high. Now we will see the causes of hyperlipidemia. Hyperlipidemia has many causes. Some are related to lifestyle and some are the result of medical issues. First, we will see the diet. Cholesterol, a waxy substance, is a type of fat the body makes. It can also come from what client eat. Foods that have cholesterol, saturated fat, and trans fat can raise the blood cholesterol level. These include cheese, egg yolks, fried and processed foods, ice cream, pastries, red meat. Other causes include smoking, drinking a lot of alcohol, sitting too much instead of being active, being stressed, inheriting genes that makes the cholesterol levels unhealthy, and being overweight. Medications that are helpful for some problems can make the cholesterol level fluctuate, such as birth control pills, diuretics, corticosteroids, antiretrovirals used for HIV treatment, beta blockers, acne medicines, cancer medicines, and some medicines which used for organ transplants. Medical conditions that can cause unhealthy cholesterol levels include diabetes, liver disease, problems with the pancreas, multiple myeloma, polycystic ovary syndrome, hypothyroidism, lupus, sleep apnea, primary biliary cholangitis, having overweight or obesity, chronic kidney disease, HIV or AIDS. Factors client can control, such as inactivity, obesity, and an unhealthy diet, contribute to harmful cholesterol and triglyceride levels. Factors beyond the control might play a role too. For example, the genetic makeup might make it more difficult for the body to remove LDL cholesterol from the blood or break it down in the liver. Age is another factor. As client age, the liver becomes less able to remove LDL cholesterol. Now we will see the pathophysiology of hyperlipidemia. Hyperlipidemia or elevated LDL or hypercholesterolemia is simply defined as elevated concentrations of lipids within the blood. It is often that there is a combination of genetic and environmental factors ultimately contribute to a person's risk of developing hyperlipidemia and cardiovascular disease. Hyperlipidemia is started from endothelial damage of the blood vessels, leading to the loss of nitric oxide in the damaged site. This process leads to increased inflammation directly around the site of dysfunction, permitting the accumulation of lipids within the innermost layer of the endothelial wall. The lipids are then engulfed by macrophages, leading to the establishment of foam cells with the cholesterol content. This cholesterol buildup within the foam cell causes subsequent mitochondrial dysfunction, apoptosis, and ultimately necrosis of the underlying tissues. At the same time, the cells of the smooth cell encapsulate the foam cells or debris, which produces a fibrotic plaque, also known as atherosclerotic plaques, that inhibits the underlying lipids, that is the foamy cells or debris, from being destroyed. On the other hand, stimulation of the platelet activity with the tissue factors is known as primary initiator of coagulation, which increases the risk for plaque rupture and thrombosis. Types of hyperlipidemia. There are two main classifications of hyperlipidemia: familial or primary, and acute or secondary. Familial or primary hyperlipidemia. The familial type stems from genes client inherit from the parents, genetic metabolic abnormalities resulting in the overproduction or underproduction of specific lipoproteins or enzymes. Secondary or acute hyperlipidemias are very common and are multifactorial. Acute hyperlipidemia is most often the result of certain lifestyle factors. It may be from certain behaviors clients do or don't do. Other times, medicines or other health problems can cause the disease. Some people acquire it from their parents. Etiological factors include chronic disease such as diabetes, hypothyroidism, nephrotic syndrome, and liver disease. Other etiological factors are obesity, dietary intake, pregnancy, alcoholism. Medications include beta-adrenergic blockers, alpha-adrenergic blockers, diuretics, glucocorticoid, and anabolic steroids and estrogen preparations can cause secondary or acute hyperlipidemia. Familial hypercholesterolemia is one type of genetic hyperlipidemia. A change in the gene that moves cholesterol out of the body instead causes it to build up on the artery walls. Familial hyperglyceridemia is another type of genetic hyperlipidemia. It causes triglyceride levels to become too high. Familial combined hyperlipidemia or mixed hyperlipidemia is a type that client can inherit from the parents or grandparents. It causes high cholesterol and high triglyceride levels. People with familial combined hyperlipidemia often develop high cholesterol or high triglyceride levels in their teens and receive a diagnosis in their 20s or 30s. This condition increases chances of early coronary artery disease and heart attack. Unlike people with typical hyperlipidemia, people with familial combined hyperlipidemia may experience symptoms of cardiovascular disease early in life, such as chest pain at young age, heart attack at young age, cramping in the calves while walking, sores on the toes that don't heal properly, stroke symptoms including trouble speaking, drooping on one side of the face, or weakness in the extremities. Signs and symptoms of hyperlipidemia. Most people with hyperlipidemia can't tell that they have it at first. A blood test is the only way to find out if client has it. It is not something client can feel, but client may notice the effects of it someday, usually asymptomatic until significant target organ damage is done. If client has hyperlipidemia, client might not have any symptoms, but as it gets worse, client might notice leg cramps, mostly in the calves, pain in the feet or toes, chest pain, trouble breathing or shortness of breath when active, confusion or trouble speaking, weakness often in the arm. Cholesterol, along with the triglycerides and other fats, can build up inside the arteries. This makes the blood vessels narrower and make it more difficult for blood to get through. The blood pressure could go up. The narrowing of the arteries could cause several problems such as coronary artery disease. Coronary artery disease is the most common form of heart disease. When the arteries get clogged, it becomes harder for the heart to get the blood it needs to work correctly. That can lead to a heart attack or heart failure. Client may not realize it is happening until client has chest pain, also called angina, or some other symptoms of a heart attack. Next problem is heart attack. The stuff clogging up the arteries called plaques can break off, creating a blood clot. The clot might block the flow of blood in the artery right there, or it might break free and travel down an artery, creating a blockage farther along. If the blockage causes part of the heart to stop getting blood flow, client is having a heart attack. Symptoms of a heart attack include chest pain, pain that spreads to the jaw, shoulder, arm, back, or neck, cold sweat, indigestion or nausea, shortness of breath, dizziness, fatigue. Women may have a sharp pain in the back, neck, or arm. Another problem a narrower artery can cause is a stroke. When client has a stroke, a clot travels through the body and blocks blood flow to the part of the brain. Symptoms of a stroke include headache that comes on suddenly and is severe, trouble speaking, slurred words, or not able to speak. Client might also have trouble understanding what people are saying, numbness or weakness. This may affect just one side of the body. One side of the mouth may droop when client try to smile. Vision problems. Client eyesight might be blurred in one or both eyes. Balance issues. Client might have trouble walking. If client has inherited hyperlipidemia, client might see yellow fatty deposits under the skin. There are places where cholesterol has built up. If they are around the eyelids, next to the nose, they are called xanthelasmas. These deposits also can show up other places on the body, and when they do, they are called xanthomas. The most common places to get them are the elbows, knees, other joints, hands, feet, and butt. Some people may have corneal arcus. It is caused by the deposition of the lipids in the cornea around the iris. Person may have pancreatitis. Some person may have a carotid bruit. Carotid bruit is an abnormal vascular sound indicating turbulent blood flow through a narrower artery. Some people may have transient ischemic attacks. Transient ischemic attacks is like a stroke, but the effects are temporary. Some people may develop intermittent claudication, that is arterial occlusion of lower extremities, causing losses of pulses. Hyperlipidemia usually does not show symptoms until it has advanced to the state where people have emergency complications such as a heart attack or stroke. These can occur when high cholesterol has led to plaque buildup in the arteries that limits or blocks the flow of blood. Now we will see the diagnosis and test. Hyperlipidemia has no symptoms, so the only way to detect is to have blood test called a lipid panel or a lipid profile or a lipoprotein panel. The results of this test show the levels of LDL cholesterol, that is the bad cholesterol, builds up inside the arteries, HDL cholesterol, the good cholesterol that lowers the risk of heart disease, triglycerides, another type of fat in the blood, total cholesterol, a combination of the other three numbers. Total cholesterol less than 200 mg per dl, bad cholesterol that is LDL cholesterol less than 100 mg per dl, good cholesterol that is HDL cholesterol at least 60 mg per dl, triglycerides less than 150 mg per dl are the normal values. Safe levels of cholesterol can vary from person to person depending on health history and current health concerns. The American Heart Association recommends that adults 20 and older have their cholesterol checked every 4 to 6 years. Client may have to fast 9 to 12 hours before the test. The healthcare provider may also do these tests: high sensitivity C-creatine protein, lipoprotein A, apolipoprotein B, coronary calcium scan. Now we will see the management and treatment for hyperlipidemia. Lifestyle changes are the first line of treatment for hyperlipidemia. Some people can just change their lifestyle to improve their cholesterol numbers. For other people, that's not enough and they need medication. Lifestyle changes are often key to managing hyperlipidemia at home. Even if the hyperlipidemia is inherited, lifestyle changes are still an essential part of treatment. These changes alone may be enough to reduce the risk of complications like heart disease and stroke. If client is already taking medications to manage hyperlipidemia, lifestyle changes can improve their cholesterol lowering effects. The lifestyle changes include: eat a heart-healthy diet. Making changes to the diet can lower the LDL cholesterol levels and increase the HDL cholesterol levels. Here are a few changes clients can make in their diet. Choose healthier fats. Avoid saturated fats that are found primarily in red meat, bacon, sausage, and full-fat dairy products. Choose leaner proteins like chicken, turkey, and fish when possible. Use monosaturated fats like olive, avocado, and canola oil for cooking. Cut out the trans fats. Trans fats are found in fried food and processed food like cookies, crackers, and other snacks. Check the ingredients on product labels. Skip any product that lists partially hydrogenated oil. Avoid sugary drinks and added sugars. Increase the fiber intake. Eat more fiber-rich foods such as oatmeal, apples, bananas, pears, prunes, kidney beans, chickpeas, lentils, and lima beans. All fiber is heart healthy, but soluble fiber, which is found in oats, bran, fruits, beans, and vegetables, can lower the LDL cholesterol levels. Eat more omega-3s. Omega-3 fatty acids have many heart benefits. Have fish twice a week. Fatty fish like tuna, salmon, mackerel, herring, trout contains omega-3 fatty acids which lower the triglycerides. Client also can get omega-3 from walnuts, flax seeds, and canola oil. Eat more fruits and veggies. They are high in fiber and vitamins and low in saturated fat. Therapeutic lifestyle changes should be considered immediately for all patients with hyperlipidemia and are an important adjunct therapy for patients who receive medications. Therapeutic lifestyle changes can help reduce the low-density lipoprotein cholesterol in the blood. Seek strategies to stop smoking. Smoking lowers the good cholesterol levels and raises the triglycerides. Even if client hasn't been diagnosed with hyperlipidemia, smoking can increase the risk of heart disease. When clients stop smoking, the HDL, that is the good cholesterol levels, go up. To quit smoking, clients should focus on the motivation for quitting, get support, maintain the confidence level, and learn from past attempts. Sleep at least 7 hours each night. Poor sleep has been linked to high blood pressure and heart disease. Manage the stress level. High stress is linked to inflammation in the body, which can raise the blood pressure and lower the HDL levels. Limit the alcohol too. That means no more than 1 drink a day. Losing a few pounds to reach a healthy weight. If client has high body weight or obesity, losing weight may help lower the total cholesterol levels. Physical activity is more important for overall health, weight loss, and cholesterol levels. When clients aren't getting enough physical activity, the HDL cholesterol levels go down. This means there isn't enough good cholesterol to carry the bad cholesterol away from the arteries. Clients only need 40 minutes of moderate to vigorous exercise 3 or 4 times a week to lower the total cholesterol levels. Even 10 to 50 minutes at a time can make a difference. The choice of medication or combination of medications depend on various factors including the personal risk factors, the age, the health and possible drug side effects. Drug classifications. Statins are the first line of treatment for people at high risk of heart disease and disease of the blood vessels or have high cholesterol and high triglycerides in the blood, known as primary hypercholesterolemia and mixed dyslipidemia, whether or not this is inherited in the genes. Statins are a type of medication that decreases how much bad cholesterol is circulating in the blood. They also raise levels of HDL, lower levels of CRP, and may lower triglycerides. They can be used alone or in combination with other lipid-lowering drugs. But in some people, statins cause serious side effects including muscle pain, mental confusion, and digestion problems. In rare cases, they can cause liver damage. So, if the client is taking statin, they require liver function monitoring. Should not be taken with grapefruit juice. It can increase the risk of myopathy. Should not be taken by women who are pregnant, lactating, or plan to get pregnant. Some people may need other treatments to bring their cholesterol under control, especially those who can't take statins or can only take a lower dose. At the moment, the next step is to offer ezetimibe, which can be taken on its own or in combination with the statin at the highest dose. It is suitable for anyone at high risk of heart disease and blood vessel disease, whether or not they have had a previous event such as heart attack or stroke. The drug ezetimibe is a cholesterol absorption inhibitor. It is a newer type of lipid-lowering drugs that blocks or inhibits cholesterol absorption that are eaten from being taken into the body by the intestine. It helps reduce the blood cholesterol. If this drug doesn't bring down the cholesterol levels, the next choice is PCSK9 inhibitors. PCSK9 is a protein in the liver that can increase the cholesterol level. PCSK9 inhibitors are also a new class of drugs. These drugs work by blocking the receptors of the protein, which allows the liver to clear away more cholesterol. These drugs can help the liver absorb more LDL cholesterol, which lowers the amount of cholesterol circulating in the blood. Examples of these medicines are alirocumab and evolocumab. Next drug is vitamin B3. Nicotinic acid has complex effects on lipoprotein metabolism. Nicotinic acid reduces the production of triglycerides and very low density lipoprotein, which is converted to LDL in the blood. It works by inhibiting VLDL secretion, thus decreasing the production of LDL. This leads to decreased LDL cholesterol, increased HDL cholesterol, and lower triglycerides. Next drug of choice is bempedoic acid. This newer drug works in much the way as a statin but is less likely to cause muscle pain. Adding bempedoic acid, or other name is Nexletol, to a maximum statin dosage can help lower LDL significantly. A combination pill containing both bempedoic acid and ezetimibe also is available. Nexlizet is a combination of bempedoic acid and ezetimibe. Next drug is bile acid binding resins or bile acid sequestrants. The liver uses cholesterol to make bile acids, a substance needed for digestion. The medication cholecystomin, cholecerol, and cholestypol lower cholesterol indirectly by binding to bile acids. This prompts the liver to use excess cholesterol to make more bile acids, which reduces the level of cholesterol in the blood. The fibric acid derivatives or fibrates. Their main action is to reduce triglyceride levels, but they also tend to reduce LDL cholesterol levels and help to raise HDL cholesterol. The medications fenofibrate and gemfibrozil reduce the liver's production of very low-density lipoprotein cholesterol and speed the removal of triglycerides from the blood. Next drug of choice is niacin. This drug limits or blocks the production of how much VLDL and LDL the liver can make. Niacin reduces triglycerides and a very low density lipoprotein and LDL cholesterol synthesis primarily by decreasing fatty acid mobilization from adipose tissue. Omega-3 supplements. Omega-3 fatty acids are also used to treat hyperlipidemia. They can help lower triglycerides. Complications of hyperlipidemia. High cholesterol can cause a dangerous accumulation of cholesterol and other deposits on the walls of the arteries called atherosclerosis. These deposits or plaques can reduce blood flow through the arteries, which can cause complications such as chest pain, heart attack, stroke, disability from myocardial infarction, lower extremity ischemia.